Hi, I'm Dr. Behnam, and I will be answering the question today, how do I know that I'm a good hair transplant candidate? This is the most important question, and there are a bunch of answers and a bunch of criteria. The most important one is, how is the donor area? The donor area is defined as the area on the side and the back of the scalp that the grafts are removed from. So the grafts in the donor area must be good quality. How do we know? How does your doctor figure that out? If a physician comes and just looks at it like this and says you're a good candidate, that is not enough. You actually have to use a microscope as well as densitometer to really figure it out. So let's see how to do it. This is really a microscope, right? And this is an example, right, of how it looks. And this is an example of good quality donor hair. So what do we see here? Well, we see that each graft, right, diameter is consistent from one graft to another graft. That means this area over here, miniaturization, that means thinning, is not occurring. So all the diameters are consistent, and that is what you want to see, and that is very, very important. Now, how does thinning donor hair look like? We're going to actually take a look as well at in this case, in the nape of the area, and this is how it looks like, right? You see that the individual graft hair follicles are at different stages of hair loss, such that there's a lot of thinning in between the hair follicles. There's color change, like this is lighter than this, right? And there's a lot of ones. That means there were threes or twos, they're now converted to one. This you could see, it used to be a graft with two hair, and now it's become a graft with one hair. So if somebody's donor hair looks like this, then you're not a good candidate. Now, how would you know other than using a microscope? You don't. The doctor has to take the time and evaluate it. There have been numerous instances where people have had hair transplants elsewhere, and for the first few years the hair looked great, but then after 3 to 4 years it started thinning. And when I use this handheld microscope and evaluate it, I see that there's actually active thinning going on even in the donor area. In addition, the doctor can use a handheld densitometer, right, where one can look into and evaluate the back of the scalp, the donor area, just like this. But I like to use both. So during the consultations, I like to demonstrate to my patients that, look, they are a good candidate or that they are not a good candidate. Because a lot of people come to me and say, I've been told I'm a great candidate, and then I pull up on the screen and they're not, and I tell them not to do the procedure. That is the single number one most important thing, whether you have a good donor or not a good donor. The second most important thing, right, is, are you still experiencing rapid hair loss? It doesn't make a difference how old you are, whether you're in your 20s or 30s or 40s. If you're experiencing rapid hair loss, then this is not the time to do hair restoration. I like to perform hair transplant on patients whose hair loss has slowed down over the past few years. How do we define and identify that? This is the question I ask. Has your hair loss over the past 6 months been less than the previous 6 months? Or is it increasing? If it's increasing, you wait another 6 months to 12 months. If it's not increasing, if the hair loss has slowed down, then this is the time to do a hair restoration. Because then you know, when you transplant these hairs, right, you're going to have a good quality hair, right, for the next at least 3 to 5 years. Then you don't have to have additional hair restoration. But if you're losing hair rapidly, and if you transplant 1,000, 2,000 grafts, and you keep losing more rapidly, then you know within the next 1 or 2 years you have to do another procedure. My goal is to minimize the number of hair restorations you do in a lifetime. My average is about 7 years. So 5 to 7 years, for a next procedure, that's okay. The next important criteria has to do about expectations. your expectation of how the result will be. If you expect to look like Elvis or as thick as when you were 18 years old, that's almost impossible. It's better not even do it, because then it's going to lead to disappointment. You need to have reasonable expectations. What does that really mean? That means surgically you could only put so many grafts per 1 square centimeters. Typically, in the back of the scalp, where the donor area is about 60 to 75 grafts per square centimeter. Now, when surgically we make sites, you could make it between 25 and 40 grafts per square centimeter, depending on a lot of factors. The depth of the skin, right? The length of the hair, the thickness of the hair. These things make a huge difference, and these will be determined when I see you in person. But important things are that you will always have some see-through, and that is natural as well. So please speak with your physician about what to expect, what kind of results you're going to get. That's very important. The next criteria has to do with the patient's age. I typically do not like to do any hair transplant in the frontal area for anybody less than age 25, and in the crown area for anybody less than age 30. Now, why is that? Well, because according to clinical studies and the ones that I have also performed, right, people less than age 25, right, have different facial features, right? So as you grow older, your facial features change, it matures, and a new hairline has to be age appropriate and natural. And when I say age appropriate, I mean that this hairline that you're gonna get has to look natural when you're in your 20s, 30s, 40s, 70, 80. So if you're 22 and you want your hairline down to 6 centimeters because that's where you have it, that will not look natural or age appropriate when you're at your 40 or 50. And this is really important. So the cutoff line is about 25, although there are some exceptions to this rule. For the crown area, above age 30. Because the first key criteria and goal is to cover the front so it frames your face. The crown is tougher and it requires a lot of graft, so we like to wait till past age 30. So these are the top few criteria that I have to determine whether somebody is a good hair transplant candidate, right? The back of the scalp, the donor area, have good qualities, how many threes you have, if there was any miniaturization, right? Important. What your expectations are, important. If you're having rapid hair loss or has your hair loss slowed down, important. And age, are you in your mid-20s, early 20s, or late 20s? Those really do make a difference. Thanks so much for watching, and if you have any questions, you could write them in the comments and we'll answer them in the next Q&A.